I encounter a lot of riders who are having difficulty picking up one canter or local lead or the other, and horse factors aside, such as cueing and training issues, which can be the subject of a whole other long video. A lot of the time the rider's pelvis position is stuck in a left lead position or a right lead position due to the rider's asymmetries or just a lack of awareness of how to position their pelvis. And so, for example, if the horse is to pick up the right lead, what's required of the horse's body is basically the whole right side of the horse needs to be able to reach farther forward than the left side. That's in their back because the right front and the right hind legs are both reaching farther forward than their left counterparts. So what will happen is the rider needs to have their right side of their pelvis further forward to allow the horse to be able to do this. And this also goes with our cueing, right? Our outside leg is back, our inside leg is at the girth. Outside leg is talking to the hindquarters, inside leg is talking to the shoulders and rib cage. So this pelvis position that allows the horse's body to be able to do the right lead without blocking it also puts your legs in the position, outside leg back, inside leg forward at the girth. But what I see a lot of times is the rider's having trouble getting the right lead because their pelvis is stuck like this. So they're trying to get their outside leg back, but their pelvis is like this, they can't get their outside leg back. And so in your assessment sections, you're going to have lots of things to do to look at that if you actually have a restriction that needs corrective exercises. But if it's just simply an awareness thing, these exercises are going to help you. So quite simply, put your hands on the top of your pelvis, and what you're going to try to do is use your abdominals to pull one side of your pelvis forward and back. So this would be my right lead pelvis position, and without even changing what my legs are doing, just using my abdominals to move my pelvis. This is my left lead, so I'm going to use my abdominals to pull the left side of my pelvis forward. And so you're going to compare right side, left side, see which side is easier. And again, this movement should be coming from here. In my program, if you're in my program, the core twist exercises are going to help you be able to use the muscles that you need to do this. So that's one very easy way that you can tell if it's just a body awareness thing, right lead or left lead, or if you're going to feel restrictions that you need to do further programming for. Now, a little bit harder exercise, but a really, really good one for this. You need to have mastered standing on one leg and having your eyes shut while standing on one leg. And you also need to make sure you've done some glute medius exercises, like clamshells, and some foot exercises to make sure that your foot's engaged to stabilize you. Have a wall beside you when you're doing this, just for safety, so you can grab onto the wall in case you lose your balance. But what you're going to do is you're going to engage your foot, engage your glute medius, and you're just simply going to lift one leg, try to keep your pelvis level and shoulders or collarbone area level so you're not tipping like this, and you're going to engage your oblique abdominals, like from the core twist exercise, and pull one side of your pelvis forward and back. So if I put my hands on the top of my pelvis, I'm going to notice that my left hip goes forward and back. And it's like I'm swiveling around this grounded right leg. So I'm going to, again, forward. This is my left lead position, and back. This is my right lead position. So be able to control this without dipping or twisting. Be able to do this on the other leg too. Engage your foot, engage your glute medius, keep your knee from falling in. Right lead, left lead. And this also, when you're doing the left lead, you're getting your leg back similar to how you would be to cue the left lead. So this is good for lead departures and lead changes as well as other lateral movements. The other implication with this is that I often have riders, when I'm teaching them, for example, haunches in or Travers, they have a lot of trouble turning their belly button, say, towards the wall and getting their outside leg back. Say this is my wall and I want to do haunches in to the right. They have trouble looking where they're going down the arena, but putting their pelvis towards the wall to steer the horse's shoulders towards the wall. So just doing these exercises can help you with that. So I can look where I'm going, say riding down the wall, swivel my belly button towards the wall and outside leg back using my core. This is my haunches in position. And just make sure you're doing it without leaning forward, because when you're riding, you need to be connected in the seat, moving with your horse. So you're engaging your abdominals to keep your neutral pelvis looking where I'm going, but my belly button is towards the wall and my outside leg is back. A lot of riders, when I ask them to do this, they go like this, and now they're not able to look where they're going. They're looking at the wall, or they're not able to get their belly button to the wall. So really important exercise. try that out both sides, see which side is more restricted, and go back to the self-assessments if you need further programming.